everyone. My name is Andrea, the founder and CEO of Better Together. Today, I am joined with the lovely Laurie Litt and Joann McEniry from Edge, New Jersey. Today, we want to learn what is going on with Edge, how you guys are helping the community, and what's going on with the nonprofit. So Laurie, tell me a little bit about yourself.
Hi, Andrea. I'm Laurie Litt. I am the CEO of Edge, New Jersey. I have been with the organization since its inception in 1994. Over the past, 27 years, we have had several names, but our mission has pretty much stayed the same. Our mission is to take care of the HIV and LGBT communities in the areas of housing, supportive services, prevention strategies, and anything that is brought to us as a concern, we try and find a solution.
Awesome. So Edge has been around since 1994, you said. Joann is here too. Joann, when did you join?
Actually, shortly after Laurie in 1999. It's a funny story because I was actually placed when we were called the Eric Johnson House. I was actually placed in our transitional housing facility for homeless men and women as a result of an internship that I was doing in my bachelor's of social work program. And I always like to say that I didn't find the agency found me because I didn't really select or decide that I necessarily wanted to come have an internship at that point, the Eric Johnson House. I was just kind of placed there. And today, every day, I'm grateful that I was, because it's, been 20 something years later and I'm still here. And, now fortunate enough to be in the role of the chief operating officer of the organization.
All right. So you've had a long-standing career with the Edge Pride Center, formerly known as the Eric Johnson House, right? Throughout the years, has the demographics changed, or have you been serving the same population?
It's changed a little bit. When we started, the focus was really on the HIV community, but as we continue to grow, we found that the primary focus was homeless HIV in the very beginning. But as we grew, we found that there were people that didn't necessarily need the housing services. And then as we continued to expand to do programs for people that didn't need housing, we found that there were people that needed some of our behavioral health and counseling services or support groups that weren't HIV positive, but were in at-risk communities, and primarily the LGBTQ plus community. So as we have expanded and grown, so has our demographics.
Now, you talked about programming. What type of programming do you currently offer?
So we offer a host of services to both the HIV positive communities and LGBT communities, both social services and then medical and psychiatric care as well. Easiest way to describe what we offer would be to just kind of divide us into our pride services and our wellness services. So our wellness services pretty much provide not only medical care for the LGBT community, but also for the HIV community. But we also provide psychiatric care as well. And so we have a contract with a community partner on site that we can prescribe prescriptions for mental health medications. We have clinicians on site that can do behavioral health and substance use counseling for individuals. And then we also have a host of kind of support groups that we offer. And those support groups really cover a range of needs that the community presents. We have an HIV support group for gay men. We also have a transmasculine support group. We have our gender non-binary support group. We have a support group for youth, LGBTQ plus youth. We have a support group for parents of the youth. When we began, we actually launched our first group for the youth, and we realized pretty quickly that we needed to do something for parents as well. And so they run concurrently at the same time. So that's kind of our medical service program. We also do hormone replacement therapy in addition to, just HIV treatment and care. And so we do have a large number of individuals from the LGBT community that we serve because of our gender affirming healthcare services, which isn't the case in the full medical community or everywhere you go. We have a lot of patients that report experiencing stigma and discrimination with other medical providers. So, the work we do medically is essential. And then we have like our community support service programs, both through our Pride Center and our Wellness Center. We provide medical transportation to and from doctor's appointments. Many of the people we serve are very low income, and access to public transportation in our area is really difficult. So, we are physically picking people up and bringing them to critical life-saving appointments. We have a full case management program. So, we have individuals that are checking in with clients every single day to help respond to whatever their needs may be. Things like maybe applying for benefits or, issues with housing that come up. We run a pretty robust housing program, a residential service program for HIV positive individuals. And we just launched our first housing program for LGBT youth. Something we're very, very proud of, because, as a significant amount of youth are displaced. I think it's 120% of LGBT youth. They have 120% higher likelihood of being homeless. And most of that is attributed to family rejection. So we've brought our first four youth into that housing program, which we're really excited about. And we also have, as I mentioned, the support groups. Laurie, did I leave any of our programs out? I know we've grown so much over the years.
We also have PrEP services and NPAP services in the clinic setting. So more prevention-based programs.
Can you tell me what does that stand for? Is it NPAP?
Yes. So the PrEP is, make me figure.
Pre-exposure prophylactics.
Thank you. And NPAP is post-exposure prophylactics.
All right.
PrEP is something that
I know it's hard, and I feel like in nonprofits we're always like, oh, and the acronym. And
yeah, social work should have a class that every social worker has to take on, understanding acronyms, and every agency has their own, which we use that in our name, EDGE, End Discrimination, Gain Equality. And our previous name, NJAS, was New Jersey AIDS Services. So we use acronyms a lot. They work for us.
I love that though. End discrimination, gain equality. I think that kind of encompasses everything that you're trying to accomplish with all the programming that you have. So what influenced you to get involved in nonprofit work? And this work in particular, is there any catalyst for you, or was it more, I know, Joann, you said it chose you. Mm-hmm. Was there any catalyst for you?
It was an opportunity. I was previously working at a homeless shelter, and a friend had said to me, there's an agency opening up in Morristown. It's a brand new agency. They're looking for an executive director. I think you'd be perfect. So I wasn't necessarily looking, but I said, okay, I'll go apply for the job. And it was to be the executive director of the Eric Johnson House. And it was a brand new program. It didn't exist. And to me, that was an amazing opportunity to create something that nobody else had done. I got to create a program that was like a home, a family, and to give people a place where they could have hope and be understood and be loved. And in social services that didn't really exist. So it was by chance opportunity that I was applied for the job and got the job, but it was where I'm supposed to be. I just think that, at some point in our lives, we find what we're supposed to be doing. I was lucky enough to find it really early in my career, and to be able to create the program and to watch it grow and flourish and continue to have such an impact on everyone we touch.
Yeah. I mean, I'm a social work educator, and I say this to my students all the time. I say, look, find a job when the alarm clock goes off Monday morning, you're excited to go to work, right? And so if you can do that, right, you're really going to be happy in life and really know that you're making a difference. And I think that for both Laurie and myself, going to work still excites us. And being part of this organization after 20 something years still excites us. And I think that's part of the reason why we've been so successful in really offering these services to the community.
We still know that there is a tremendous amount of work to be done. And, over the past few decades, we have been able to expand what we do to meet the needs. When we are presented with a community need that is within our mission, we find a way to address it and to give our services to more people, to be able to make a difference in the lives of more people. And
yeah, I love that you brought that up, Laurie, because that's a testament to kind of who we are. Our community education programs. So we do both an LGBT education program, and we also do an HIV education program. But ultimately, the LGBT program, the cultural competency and humility training, was developed as a result because we realized the community really needed education on how they can create more inclusive environments. Yes, we're a Pride Center and we do a lot of services for the LGBT community, but people of the LGBT community go to banks and libraries and OTA and everywhere else that they go, right? And so one of those programs that we launched was actually to educate other, community entities on simple organizational changes they can make so that their environment is more inclusive for people of the LGBT community, and thus they're more likely to feel comfortable and safe visiting that environment.
We need that. We absolutely need that. We still do. You're right. There is, there's always work to be done in nonprofits and especially in the LGBTQ community. I do want to ask if, during this pandemic, there's been a lot of changes. Has that affected your organization? Has that affected your population, your demographics, things like that?
Absolutely. I mean, when this all started back almost, a year ago, March, and we were like, oh, we should probably, close the agency. We should work from home. It's going to be a few weeks until we get back to normal. And so, Joann and I made the decision, okay, we're going to send everybody to work from home on March 15th. And thinking this is going to go on for a month, and then we'll figure out what we're going to do. I mean, now we're heading into a year. We have been working remotely, our entire staff, for the entire time. We have not had to lose staff. Our services have expanded. We have actually hired staff. I mean, as you know, this pandemic has affected everybody, but our clients, the isolation and stigma from, the HIV disease and just being part of the and being part of the LGBTQ community causes isolation in and of itself. So adding on to the pandemic and the quarantine has just made it worse.
Yeah, Laurie and I were looking at our behavioral health referrals and over the past few months, and there were 93 new behavioral health referrals. So, we are definitely
the last 6 months. That was just 6 months.
What's like in a average year, what was
that's probably double. We probably have about 100 a year, and since July we've had 93.
Yeah, absolutely. Well, the communities we serve are already disproportionately impacted by stigma and discrimination. They're already marginalized and oppressed communities, and so to further add social isolation to that, right? We are seeing significant impacts in not only mental health functioning, but substance use as well.
So now how have you been able to address that? Is that more virtual things going on? Really?
We have all of our services are done virtually. We made sure that every employee had a laptop to take home to do telehealth services, to make sure that they have food. We have been able to give ShopRite gift cards to our clients on a monthly basis for the past few months to make sure that they have nutritional food in their home, to make sure that they can get their telehealth visits through our clinic services, and just checking in on a regular basis, letting them know that even though they can't come see us or come to our facility, we still care about them and want to stay connected to them.
Yeah, it's challenging though. We are probably admitting 3 to 5 people a week at this point into our behavioral health care program. So you can imagine it's stretching some really limited resources that we have.
Yeah, we have 3 full-time clinicians and their caseloads are full.
Oh, wow.
We have several social work interns, and they're seeing clients as well, and their caseloads are full. So we are right now hiring a new case manager and another part-time clinician.
Would you say that that's your biggest need right now? What is your biggest need right now? I'll ask you.
Well, yes, we do need more staff, and we do need to provide for the people coming in. And one thing that Joann and I both agree on is that we never want to have to tell somebody, we'll put you on a waiting list and get back to you in a few weeks, especially with behavioral health services. When somebody is coming to you and seeking services, they need to be seen immediately, or you lose them to care. You can't send them someplace else that will give them the level of care that we can provide. And if you can't provide for them in that moment, they may not come back. And with our population, that could mean they go out and use substances or harm themselves, many things that can go wrong. And we don't ever want to be able to turn people away because we don't have the resources. So we find a way to provide those services. But right now, yes, we do need more staffing.
Yeah, I mean, we're a sole source provider, right? We are the only LGBT center in all of Morris County. So we definitely, there's a lot of demand, right? And so, and it's really important that when people of the LGBT community need behavioral health counseling, that they get it from competent providers who understand the unique experiences of people of the LGBT community, right? And so there's really not a lot of providers. So it's not as easy as saying, well, can't you just send them to another mental health provider? Yeah, we can, but the experience and the clinical interventions are not going to be uniquely tailored for the LGBT community. So it's our area of expertise, and we do great work. So definitely need that. And the other thing I would add is, like, another need would certainly be for people to participate and lend a hand. We have lots of opportunities, all different kinds of opportunities for people to get involved with our organization. Obviously financial support and donations are always welcome, but there's volunteer opportunities. You can participate in an event that we're having as well. We have family fun events. So, it's really, they're all age appropriate. And
we had a trivia day for our LGBT youth, just things to keep people connected, that anybody is welcome to join. Some of our interns put together a Hope music night where we asked our residents to talk about their favorite song and what it meant to them. And then we all got together on a Zoom call like this, played the songs and talked about them. And it's just seeing people's faces and feeling like they're being heard and just connecting with other human beings. This pandemic has created an isolation, not just for our clients, but some of our staff as well. As social workers, we like the social part. We like to be with each other and work together and be a community and a family. And we have to find creative ways to do that. But, and we've had to find creative ways to also fundraise. We spend a lot of time, writing grants and looking to foundations and government for funds, but we also had a whole year of special events that had to be revamped to be, social distance or virtual. It's hard to do an AIDS walk and have the energy of that. Our AIDS walk last year was 2 months after the pandemic started, and it had to be completely revamped. So it was like trying to figure all of that out. So yes, having participation in these things is also a great need.
I appreciate your time. Honestly, I have learned so much. I've known about Edge Pride Center for a very long time, since I moved out here pretty much, but I've learned so much today. Just in terms of last little bit of advice, like, what advice do you have for your community? What advice do you have for nonprofit leaders? If you had just a minute to tell them one thing, what would you tell them? Joe, who wants to go first?
Sure, I'll go first. I mean, my advice to nonprofit leaders would be listen to the community, right? All of the programs that we have created have responded to a need and gap in the community. They weren't always well funded, right? We didn't necessarily chase the grants. What we did was listen to what the people needed and worked to create that and found resources to support that, some of which we're still looking for resources to support. But listen to the community and respond to what your community needs that you're serving. And their voice matters, and they'll tell you the programming that's missing from their lives that would improve their lives and make it better. And if I was going to say something to community members, I would say you're not alone, right? You're not alone, that there are agencies and resources out there to support you. Edge is here. Come to our website, nj.org, and we will be sure that if we don't provide it, we will link you to a service that you can receive. And so remember that you're not alone and that there is somebody to walk with you on your journey.
Yeah, and in addition to what Joann said, what I would say to community leaders is take care of your staff. They're your greatest asset. And if you can take care of your staff and they want to wake up and come to work Monday morning, they're going to be providing the best care to your clients. And at the end of the day, helping our clients is the most important thing we do. So I may not be the one that's talking to the clients, but if I know my staff is happy and taken care of, they're going to be projecting the services and portraying the agency the way I know the clients will get the best care necessary. And to the community, I guess my advice would be, again, similar to Joann. We are here for you, and this too shall pass. We will get through this, and we will be together again, and it will get better.
Laurie, Joann, that was absolutely wonderful. I do want to just repeat your sentiment of your employees are your face when you're not there. They're always, they're putting their best foot forward. And if they're not, you're going to hear about it. So yeah, absolutely. Nonprofit leaders need to acknowledge their employees. Listen to your community. Like, those praise hands. Yes. Listen to your community. That's what we're trying to do here as nonprofit leaders. Understand and fill those gaps in services. So ladies, Laurie, Joann, I thank you so much. We're going to put all of your information up on Better Together Community on the YouTube channel, on Instagram, on Facebook. We're going to be everywhere. So we're going to try to get you to learn more about njas.org, right? Is that your website?
It's actually edgenj.org.
edgenj.org. All right, we'll get there.
We're still in the process of finalizing our name change. So half of our articles of incorporation now say Edge New Jersey.
Oh, that's always fun when you're trying to do your grants.
Oh, right. But 501c3 document still says New Jersey Aid Services. So, I'm waiting for the government to catch up.
Oh, it's very quiet right now because they're trying to figure out everything, and they're like 10 months behind.
Right.
I've actually been with an organization
on top of the list of things for them to get done. So
yeah, I'm trying to get a 501c3 through for someone, and they're like, we'll find it. I was like, what do you mean we'll find it?